This is HubWonk 360. I'm Joe Salvaggi. I'm joined by Pioneer Institute's Dr. Bill Smith. Bill, you just released a research paper for Pioneer Institute on the 340B program, which in 1992 Health and Human Services established to help low-income, uninsured people get their medication at a discount. How does 340B work?
Well, Joe, thanks for having me. It works very simply. Basically, by statute, certain hospitals and clinics that treat lower income patients have access to deep discounts by statute for their drug purchases.
This program, designed in 1992, was it carefully written for hospitals and patients to interpret?
No, actually, as I say in the paper, I think it's quite poorly written because while hospitals and clinics have access to these deep discounted drugs, there's no requirement that they provide them to low-income uninsured patients, nor is there a requirement that any revenue that they get from selling these drugs is devoted to charity care programs for low-income uninsured patients.
So while it was well-intentioned to help hospitals who treat the most vulnerable patients, it was poorly worded legislation that left a great deal for the hospitals to interpret?
Yes, the statute was very bare bones. All it says is that certain hospitals and clinics can buy drugs at deep discounts. What they do with those drugs, who they give those drugs to, and any revenue that comes from selling those drugs is not addressed in the law.
So in what way can and do hospitals exploit this weakness or vagary in the legislation?
Well, first, I want to cast aspersions on all hospitals and clinics. Some do provide a lot of charity care, and they use this program quite well. But other hospitals have discovered they can arbitrage these discounts. And what do I mean by that? I mean by that is they can buy an oncology drug at $25,000, give it to a wealthy patient in a wealthy neighborhood, and then bill that wealthy patient's insurance company for $100,000, which is the list price of the drug, not the 340B discount. Then they can pocket $75,000. And I just don't think Congress ever intended this program to be an arbitrage revenue source for hospitals to provide drugs to wealthy patients.
So does that mean that if this 340B program makes treating uninsured or poor people more profitable, does that mean the populations, those vulnerable populations, are getting more services or better treatment because of it?
No, actually, Joe, the data suggests that they're not. One of the most concerning studies I read when I was preparing my paper was a study that its conclusion was that low-income uninsured patients are having a more difficult time now than they were at the beginning of the 340B program. In other words, there's an inverse relationship between the growth in the 340B program and the ability of low-income uninsured people to access medicines and healthcare.
So your research is actually showing a negative correlation between the profits reaped by 340B programs and the money being directed to serving the poor.
Yes, and in fact, there's some studies that indicate that 340B hospitals provide less charity care than for-profit hospitals.
So to be clear for our listeners, is the program capped by the number of vulnerable patients hospitals can treat? In other words, if I treat 2 patients that are uninsured, is there a limit to how much I can have access to deeply discounted pharmaceuticals?
No, a hospital can buy as many drugs as they want under the 340B program. There's no cap and there's no limit. And that's why the program has grown from 9 billion in sales in 2014 to about 30 billion last year. So there's no cap. I'm not in favor of putting a cap on it because if these hospitals and clinics devoted all the revenue they got from selling 340B drugs to charity care programs, that would be fine with me. I wouldn't want a cap.
So your view, this is a well-intentioned program that's directing money to people who need the help, but the fact that it's being directed, the profits are going elsewhere, makes it problematic. Now, the Affordable Care Act has demonstrated an ability to reduce the number of people uninsured with no health insurance. Does the fact that there are fewer people without insurance mean that this 340B program is naturally diminishing in size as we move forward?
Well, that's what we would have expected because There were only 54 million people on Medicaid in 2012, which is the federal program for low-income people, federal insurance program. And now there are 83 million people on Medicaid due to the Affordable Care Act and COVID and a number of other reasons. More and more people are now being covered by Medicaid. So one would have expected when more people are insured, there'd be less need for a discount program to help the uninsured. The opposite has happened. The program has exploded in growth. At the same time, more and more people have gotten federal Medicaid coverage.
So, Bill, what needs to be done to stop the abuse of this well-intentioned program and ensure that the most vulnerable people get the help they need?
Well, there'd be a couple simple things that Congress could do. One would be to require that the hospitals and clinics only provide these drug discounts to people of a certain lower income, not provide them to wealthy patients where the drug discount can be arbitraged. Another simple thing Congress could do would be simply to say, every dime that comes in from this 340B program has got to be devoted to charity care and community care for low income and uninsured patients. Right now, there's no requirement that any revenue that comes in from the program be devoted to these programs, which was the statute's original intention.
So Congress needs to reform the law to better link the benefits with the beneficiaries, and hospitals need to have an incentive to treat the needy rather than use them as a pretext for acquiring discounted drugs. Is that what you're saying?
Yes, quite simply, the program, it has done many worthy things, and there are still hospitals and clinics who use it quite well. But for many hospitals, it's simply become a revenue stream, and the original goal of serving low income and uninsured patients is being lost.
Bill, thank you for being on HubWonk 360.